Welcome back to my YouTube channel. In the course of this video lesson, I'll be teaching on the introduction to the subject anatomy. So let's get started. So the first question we ask ourselves, what is this course called anatomy all about? So you have to pay close attention to every information to be shared in the course of this class lesson. Anatomy is a branch of science, pay attention, that deals with the study of the, listen, all right? In anatomy is a branch of science that deals with the study of one, number one, the structure, all right? These are what we study in anatomy, all right? We study the structure, not just the structure, pay attention. Also, we also study the organization, all right? The organization of the human body. Are you there? So anatomy is a branch of science that deals with the study of, number one, the structure, and also the organization of the human body, the way you are seeing it on the board. Are you there? So listen properly. So in anatomy, we study the structure. I believe you can see from this diagram on the board, you can see different structures of the human body. All right, this is the head, which is a structure of the human body. This is the neck, which is also a structure of the human body. These are the limbs. Pay attention. All right, you can see these are the limbs as well, which is also another structure of the human body. So in anatomy, we study these structures, and also we study how they are organized together. Are you there? That is why I said that in anatomy we study the structure and organization of the human body. This is what anatomy is all about. But let us move further. Now, moving further, anatomy as a subject or as a course forms the foundation for understanding how the human body works. Listen to what I just said. Anatomy, all right, forms the foundation for understanding how the human body works. So you can see what I just said. I said anatomy forms the foundation. It forms the foundation. All right, it forms the foundation for understanding how the human body works. Listen and listen well. In anatomy, we don't really study how the human body works. Listen, the branch of science that studies how the human body works, because this phrase saying how the human body works simply explains the functional aspect of the human body, not the structural. But if you understand first all of the structures of the human body, which is what we study in anatomy, you'll be able to form a firm foundation in understanding how human body works. And how human body works is studied in the course called physiology. All right, so this must be noted. This must be noted. So anatomy, you can see why anatomy and physiology, they are studied together. It is very essential, because for you to be able to understand physiology properly, you need to have a very firm foundation in the subject anatomy. And in the course of this class lesson, I'm going to explain all the bases you need to know as far the subject anatomy is concerned. You can see what I just said. I said that anatomy forms the foundation for understanding how the human body works. All right, because if you don't understand all the structural aspects of the human body, how these bodies are organized together, it will be difficult for you to understand the functional aspects. That is how the body works. Because physiology studies the functional aspect of the human body, while anatomy studies the structural and the organizational aspect of the human body. This must be noted. Now, moving further, anatomy as a subject helps us answer two important questions. Pay attention. This is how we are going to start this course called anatomy. So listen. So I just said now that anatomy helps us to answer two vital questions. And what are these questions? I'll be writing them on the board. All right, just pay attention. The questions are, now pay attention. Here are the questions that anatomy helps us to understand. All right, so here's the first question. The first question is, what is the human body? All right, what is the human body made up of? All right, this is the first question, and we are going to answer it together because anatomy has explained it for us. Just pay attention, relax. In the course of explaining, we will be solving and answering likely multiple choice questions that you may likely see in your exam, irrespective of the kind of exam you are preparing to write. So this is the first question anatomy has helped us to understand or answer. Now the next question. The next question is, where is each part? Where is each part of the body located? All these things are very essential. There are questions that we need to provide answers to. If we can provide answers to this question, gradually we'll get to understand the overview, the overall basis of the subject called anatomy. So the first question is, what is the human body made up of? Now listen properly. The human body, all right, I repeat, the human body, you and I, is made up of structures of different sizes. You can see it here. Structures of different sizes, not just sizes, but also complexities. So the human body is made up of structures of different sizes and complexities. When I say complexities, some of these structures could be cell. This brings us to the level of organization of life. You know, some organisms or some life species exist as cell. Hope you know what I'm talking about. You know, this is the level of organization of life ranging from cell, and cells give rise to tissues, and tissues will not give rise to what? Organs. Are you there? Organs will not give rise to system, and system will give rise to what? The organism itself. All right. So basically, what I'm saying right now is that the human body is made up of structures of different sizes. All right. Some of them are bigger than the other. And also, the human body is made up of structures of different complexities. Some of these structures could be cell. Some of these structures could exist as tissues. Some of these structures could exist as organs, all right? Some of these structures could exist as system. Are you there? And all of these together forms you and I, which is the organism. Are you there? And when these structures I am talking about that are of different sizes and complexity comes together or are organized together, because we said that initially anatomy deals with the study of the structure and also the organization of the human body, right? So when all of these structures are now organized together, they now form different regions of the body. Are you listening? That is why we have different regions of the human body, which I'll be talking about in the course of this class lesson. Now, when we talk about the regions, you know the regions of the human body. Like, for instance, this is the head region. So, here is the head what? Region. Pay attention. And anatomically, because we are about to start learning anatomy, it is very essential we know the right terms to read. We don't just call it the head region. We don't just do as if we are still in basic level, all right? Now we are now going advanced. Then we have to use the right terms for all of this region. Like the head region of the body is called anatomically the cephalic region. Are you there? So pay attention. All these are essential. So you can see what I'm talking about. So, so we said that when all of these structures of different sizes and complexity now are now organized together, they form different regions of the body. So this is the head region. The head is made up of different structures. Hope you are aware. We'll talk about that. Now, this is the neck region of the body, all right? The neck region of the body. And the neck region anatomically is called the cervical region of the body. All right, it's called what? The cervical region. You know this, all right? The cervical region of the human body. Now, moving further, what about this region? This part of the body is called what? The chest region. Layman term, chest region. All right, so this is the chest region. Let's just call it chest region. All right, but basically, anatomically, it should be called the thoracic region of the body. All right, so the right term to use is called thoracic region of the human body. Hope you are aware. All these things are easy, they are not hard at all. It's better we start using the right term to explain all of these things. If you don't want to call it thoracic region, you can just call it thorax. You are okay. So if you want to call it chest or thoracic region, you can just say, oh, this is my thorax. All these are essential. What about this region of your body? Most persons say, this is my stomach. This is not your stomach. Your stomach is a structure inside this region, all right? Your stomach is an organ. Remember, we said that when all of these comes together, they now form all of this region. Do you understand? So it is not just because most people say this is my stomach, this is not your stomach, this is the abdomen. All right, you call it the abdomen. Are you there? Or you can call it the abdomen, you can just call it the abdominal region of the human body. All this is essential. Now, moving further, what about this region? Layman term, waist region. All right, they call it waist. This is your waist region. But the right term is called the pelvic. The pelvic region of the human body. The pelvic. All right, or you can call it pelvic, you can call it pelvis. All right, if you call it pelvic, you cannot call it what? Pelvis. Here is the spelling, pelvis. All these are essential. All right, they are very, very important. Pelvis. All right, so that is for that. I know right now you are wondering, we've not talked about this region of the human body, this region. Most persons will just, oh, this is my hand now. Is this not my hand? This is my hand. No, that's not your hand. This is your hand. Don't confuse these few regions. for just your hand. This your hand. Do you understand? Just pay attention. This full region of the human body, they call it the upper limb. Let me write this outside. All right, the upper limb region. All right, upper is found in the upper part of the body. That's why it's called upper limb. Now, moving further, before I talk about upper limb, it is essential I explain what the term limb means. Pay attention. Now, a limb is an appendage. Listen, when you hear the word limb is an appendage. Listen and listen well. You can say that limb is an appendage. Appendage might be a big term, but it's easy. If you don't call limb an appendage, you can simply say that limb is an appendage or an extremity. Listen, is an appendage or an extremity that projects from the trunk of the body. Listen, if they ask you, where's your trunk? Where's the trunk of the human body? You will simply say that the trunk of the human body is the central part to reach the head, the neck. So moving further, a limb is an appendage or an extremity, all right, that projects from the trunk, pay attention, of the human body, and it is used for movement and other functions. So I'm saying right now that I'm talking about the limbs. Just listen, all right? Before I stress on upper limb and the rest, I want to tell you what a limb which is why I just explained. It is an appendage or an extremity that arises, that projects from the trunk of the body. Now, trunk is the central part of the human body to which structures arises from. Like, for instance, the trunk of a tree. Do you understand? Like, this is a tree now. All right, this is a tree to which other things comes from. That's what we're talking about. So the trunk of the human body includes the chest region, the abdomen. This is where structures comes out from. The pelvis region, structures comes out from all of this region. So we call them the trunk of the human body. The back is the back. This is your back. It's also part of the trunk of the human body. Are you there? So these limbs are appendages or extremities that arises from the trunk, which is the central part of the human body. Are you there? Just pay attention. And this must be noted. Trunk can also be called torso. All right. The term trunk can also be regarded as torso. All right. Take note of that. It's essential to be noted. Now, moving further, other regions of the body include the upper limb. This is the upper limb. We have two of them. So this upper limb. So we call them upper limbs. Same applies. This is the lower limbs as well. Are you there? Now, this is another region of the body that must be noted, and it is essential we must study them. And in the course of our classes, we are going to study them one after the other. Moving further. Now, for the upper limb is made up of different regions, all right? The first region of the upper limb is what we call the shoulder region, all right? This is the shoulder region of the human body, specifically the upper limb, all right? Now, after this part is this part. Are you listening? You know, this is called the elbow region. You know what I'm talking about. This is your elbow. So this is called the elbow region. So the question you now ask me, what is this part of our upper limb called? Listen, they call it the arm. Arm. It's called arm. All right. Listen, it is called what? Arm. And if you don't call it arm, you call it the brachial region. And now, pay attention to what I just said. It's very essential. If you don't call it arm, you call it the brachial region of the body. Now, let me just tell you. Now, listen and listen well. The term brachial comes from a Latin name called brachium. Listen, the term brachial comes from a Latin name called the brachium. And brachium simply means arm. So this is your arm. Listen, this is your what? Arm. Are you there in anatomy? Whether this is your shoulder for sure, the shoulder region. Now, this part of your upper limb, what is this called? This part now, this is called the forearm. Now you can see what I just said. It looks like this. Forearm. Now listen, if you don't call it the forearm, you call it antebrachial region. This place I just wrote brachial, you now say antebrachial region of the body. So another term for forearm is antebrachial region. It also comes from the Latin name, which simply means antebrachium. Are you there? Now, anti simply means before. You know, it's called antebrachium, and this is called brachium. So before the brachium, yes, it comes before the brachium. Are you there? Or in front of the brachium. That is why it's called antebrachial region or antebrachium, which simply means what? Forearm. Now, moving further, what about this part? You know what I'm talking about this part. You know, you call it wrist. Correct. So this is the wrist region of your what? Upper limb, or you call it the carpal region. All right, you don't call it the wrist. You can call it the carpal region. All right, or the wrist region. Very, very essential. Now, moving further, what about this part? You know, this they call it digits or fingers, or what the phalangeal region or phalanges. Hope you know what I'm talking about. So these are your digits or your fingers. We are using the right anatomical terms. These things are essential because this talks about the basic anatomy, basic introduction to this course called what? Anatomy. I believe you know what trunk simply means. It is the central part of the body to which appendages arises from. Yes, which include your upper limb, your lower limb. It arises from the trunk. And the trunk is made up of the chest region, the abdomen, the pelvis, and the back. And the trunk is also called the torso. Note all these, they're essential. So moving further, all of this, we call them digits, or we call them the phalangeal region of the upper limb, all right? Or we simply call them the fingers, all right? Whereby this is your hand. This structure is your hand. This is not your hand. You can see the difference between all these things now. Please don't go and call your upper limb your hand. This is just your hand. Are you there? So all these things must be noted. Hope is making sense. So let's walk towards the lower limb and I tell you the different parts of the lower limb. Now, listen and listen well. Before we get into the lower limb, talking about the different parts of the lower limbs, I want to ask you a very easy question. You can provide the answer in the comment section. I want to ask you something. I want you to try from basic understanding so far. We've not entered other terminologies that must be noted. I'm going to talk about them, all right? But I want you to try and describe to me where your forearm is. Describe to me where your forearm is. Now listen. Is your forearm, I'm not going to point anything. Is your forearm a region of the upper limb between the shoulder and the elbow, or the elbow and the wrist? Please tell me the answer in the comment section. So I want you to be familiar with these terminologies. They're important. All right, you need to know the difference between arm and forearm. So tell me, where is the forearm? Where's the forearm? Based on the two options I got. All right, is it a region of the upper limb between your shoulder region and the elbow region, or the elbow region and the wrist region, also called the carpal region? Tell me the answer in the comment section. That's your question. So let's get into the lower limb of the human body. Talking about different aspects of the lower limbs. So moving further, the lower limb starts from this place, all right, which we call the hip, all right, the hip region. And anatomically, this hip region, they call the region. This is your thigh, all right, the thigh region. This is your thigh region, also regarded to be called the femoral region, all right. We call it the femoral region of the human body. All these are part of what? The lower limbs. Are you there? All these things are easy, they are not hard at all. Now, listen and listen well. So, what region will you call this? What this is the knee region now, the knee region. Now, listen, the knee is divided into two parts based on the view, based on your view. Now, if you look at the human in a front view, which is this, and in anatomy, when we say front view, we simply, another term for front view is called anterior view. We are going to see them properly in the course of this class lesson. I just want to talk about it right now. Anterior, there are other views, all right, but let's just talk about the anterior view, which is this we are seeing. All right, this human is showing us its front view. So this is the knee. So the front region of the knee has a name. They call it the patellar region of the lower limb. See, listen, I said the front part of your knee is the patellar region. The back of your knee is not a patellar region, but rather it is called, listen. It is called popliteal region. I repeat, it is called popliteal region. That's the back of your knee. Are you there? So all this is essential. Don't make mistakes. They are easy. They are not difficult at all. Practice makes perfect. Moving further, we have what we call the ankle region or the tarsal region. All right, the tarsal region of the lower limb. For the leg region, the leg region is called the crural region. All right, the crural region of the human body, the leg region of the human, okay, of the lower limb specifically. Whereby the foot region is called the pedal region of the human body, whereby the fingers in the foot, we call them, same applies, the phalangeal region of the human body. Are you seeing how it works? So you can see the different regions of the human body. So you can see what we have talked about. See, listen, the question you asked me, what brought us here? Is simply this first question that anatomy has helped us to understand, which is, what is the body made up of? We said that the body is made up of structures of different sizes and complexity. So it is all of these structures of different sizes and complexity that now led to the formation of all of these regions, which I just named us to be familiar with. Are you listening? All these things are not hard at all. Just pay attention. So you can see we have been able to answer this question correctly. So let us move further to answer. Questions are coming. I'm going to ask you questions based on all of these, based on how multiple choice questions can be asked based on your exam. Are you there? So pay attention, note all these things very well. So the next question we ask ourselves, where is each part of the body located? We are basically giving you the names of all of these regions of the body. So right now you can actually differentiate between your arm from your forearm. And this one is called the brachial region or the brachium, and this is called the antebrachial region or antebrachium, which simply means in front of this or before the brachium of the arm. Are you there? So we've been able to understand all the different regions of the body. And when we want to study anatomy in our universities or colleges, we study anatomy in regions. You cannot just say you want to study anatomy from the head region, which is the cephalic region, down to the lower limb region, let's say in one semester. It's not possible. You have to take your time because the head region alone has a lot of vital information that are very essential. Because all of these informations to be studied in this region are vital for you to be able to have a very good clinical knowledge in anatomy. Do you understand? So moving further, let's get into answering this question, which says, where is each part of the body located? All right, because we are seeing the different parts, but we have to know exactly where they are located. Now listen and listen well. I am going to explain something that is so important, to pay attention. Where is each part of this body located? We are coming, and questions are coming. All right, it's not just about knowing stuff. You have to use your knowledge to be able to answer questions. That's the most important thing right now. Now, moving further, let us quickly talk about other regions of the body. All right, we've listed out several regions of the body. Now, pay attention. Now, moving further, as we go deep into the course anatomy, we are going to study all of these regions one after the other. All right, let me just mention some other regions that are essential. I believe you can see this region of the body. It is called the axillar region. All right, this is the axillar region, or if you call it axillary region, you can call it the armpit region of the human body. Now, this must be noted. It must be noted here that the elbow region of the human body is also regarded to be called the antecubital region of the human body. There are several other regions, like this region is called the gluteal region. All right, this is the gluteal region of the human body. Though there are a lot of regions, and as we study anatomy in depth, we are going to learn all of these regions. Remember, I called the elbow region because this is the front view. So the front of the elbow is simply called the antecubital region. Whereas for the back view, which is also called the posterior view, we are going to learn this term as we go on in this class lesson. This back of the elbow region, they call it the olecranon region of the upper limb. It is still part of the upper limb, so we simply call this the elbow, so we call it the olecranon region of the what now? Of the upper limb, which is called the back of the elbow region. The way we call the front of the knee, the patellar region, and the back of the knee, the what now? The popliteal region. So all this must be noted. There are a lot of regions, all right? We also have the chin region. The chin region, all right? This part is the chin region. There are a lot of regions. And as we study anatomy in depth, we are going to learn all of these regions. So what will happen right now? I'll be giving us some likely exam-based multiple choice questions based on all what I've explained so far on the introduction to anatomy, explaining the definition of anatomy, and also going over to answer this question, what is the human body made up of, to basically talk about the regions of the body. All right, and I'll be asking us questions based on what I've explained so far. So do well to provide the answers in the comment section, because they are all very easy. All right, because practice makes perfect. So relax. So let's get into the question and answer section. All right, based on what I've explained so far. So let's get with the first multiple question based on what I've explained so far. So moving further, guys, let us get into the first practice questions based on the regions of the body explained. All right, before we move further, and here is the first question, which says, which of the following regions of the human body connects the head to the trunk? I told you what the trunk is made up of. I told you that the trunk is the central part of the body. I used the trunk of a tree to explain it. It's the central part of the body to which appendages or extremities arises from. The trunk includes the chest region, the abdominal region, the back region, even the pelvic region as well. All right, so now listen and listen well. Then I said, which region of the body connect the head to the trunk? Connect the head to the trunk. What connects the head to the trunk? Tell me. It is more hard. Think well. What connects the head to the trunk? It's so hard. Head and trunk, what connect? I will not say much. provide the answer in the comment section so we can move into more practice questions. So then we get into other aspects on the introductory aspect to anatomy. All right, guys, provide the answer to this question on the board is very easy. It says, which of the following pair is incorrectly matched? You know the answer. Cephalic region is matched with head. Cervical region is matched with neck. Thoracic region is matched with the chest, and pelvic region is matched with the arm. So what's the correct answer to this question? Is very easy. Let's get into more smarter questions. All right, guys, this question is for you. Provide the answer in the comment section. It's very easy. And it says, the brachial region is part of is the brachial region part of the lower, I don't want to point, all right, so I don't tell you the answer. You know the answer, I've explained it. Is the brachial region part of the lower limbs, the upper limbs, the pelvis, or the abdomen? The abdomen is also called the abdominal region. So provide the answer in the comment section. Very easy. Okay, guys, provide the answer to this question. Very easy. It says, the major purpose of anatomy is to study what I've explained what anatomy is all about. Is it only the function of the organ? Is anatomy dealing with the study of the functions of organ? No, we said what deals with the study of the functions of the human body is physiology. So please don't go with option A. You know what to do, all right? I will not say much. Option C says the treatment of disease. Though anatomy is very important in the treatment of disease, but that's not like the major. Though at the end it's still very essential. But what we majorly study in anatomy, provide the answer in the comment section. Does anatomy deals with the study of the chemical reaction? No, now that's biochemistry. Reactions that occurs in cells, that deals with biochemistry. I'm going to talk about that in subsequent classes. All right. So ensure you subscribe to my YouTube channel if you have not yet subscribed, and share these lessons with your friends. So let us proceed to more practice questions. Now moving further, let's get into this practice question, and it says, a student identifies the chest, which is the thoracic region, the abdomen, which is the abdominal region, and the pelvis, which is this waist region, as component of the trunk. Wow, something is missing. Which of the following structures has been omitted? Because when I was teaching, I mentioned something as also a component of the trunk, which is, tell me the answer in the comment section. Is so easy. So let us move further to more practice questions. Now listen properly. Before I ask the next question, let me explain something so vital. I want you to understand here that the human body could also be classified in two ways. All right, we have the axial part of the human body or the appendicular part of the human body. If we're talking about skeleton, we say the axial skeleton or the appendicular skeleton. Please listen. So we have the axial part of the human body, pay attention, and the appendicular part of the human body. As a student, it is essential you note the parts of the body that are axial and the part of the body that are appendicular. They are all easy. Pay attention. Now, the term axial comes from the word axis. Just understand here that the axial part of the body is the central part of the body. Now, you must note here that the axial part of the body or the axial part of the skeleton, if we're talking about skeleton, if I have drawn the skeleton or if I brought a model to explain that, all right, you'll see it on the board as well. You're still going to see it on the board, all right? Just listen. The axial part of the body includes the head, the neck, and the trunk, which is the central part of the body. I repeat, the axial part of the body includes three parts, all right? The head, the neck, and the trunk. Remember, the trunk is divided into the chest region, the thorax, the abdomen region, of the abdominal region, the pelvic region, and also the back region. Are you listening? So the axial region of the body is divided into three parts, primarily, which includes the head, the neck, and the trunk. While for the appendicular part, from the word appendicular, I came from the word appendage. Remember, we talked about appendage. Appendages are structures that comes from the main body. The main body is what we have talked about, which include the head, the neck, and also the trunk. So the trunk literally is the main body. So the appendages are those parts that comes from the main body, which include the upper limbs is one part of the appendicular part of the body of the appendicular skeleton. So the upper limb, the lower limbs. But if one will just be specific, we have different part of the appendicular part of the body of the appendicular skeleton, which include the upper limb, lower limb, the shoulder. These are parts that come from the main body. So the shoulder, they call it the pectoral girdle. The pectoral girdle. Please pay attention. I just said something so essential. The pectoral girdle and also the pelvic girdle. This part. So any part that comes from the main body, this is the main body, which is the trunk, and including the head and the neck forms the axial. For the appendicular skeleton or the appendicular part of the body, it includes the shoulder girdle, what we call the pectoral girdle, pectoral. Listen, it is spelled pectoral girdle. For this is called the pelvic girdle. Alright, the pelvic girdle and also the upper limb in general, the lower limbs in general. So you can see where I talked about this essential. So this is the axial part and the appendicular part of the human body. So with all this, let's get into the last practice question so we can move into the next question, which is based on where is each part of the body located. Relax. We are going to talk about this step by step. So let's solve the last question, and this is for you. Okay guys, this question is for you, and it says, which of the following regions of the body belongs to the appendicular part of the body? Remember, for you to be appendicular, you basically include structures that are found in the upper limb and the lower limb, and also two other things I mentioned, which include the pectoral girdle and also the pelvic girdle. Listen, pelvic region is different from pelvic girdle. Don't tell me the answer is C. Be very, very smart. All right, is the answer A? No, that thoracic region forms the trunk. All right, and the trunk is under the axial part of the body. All right, what about the abdominal? Forms the trunk under the axial. We'll talk about this. What about the pelvic region? It also forms the axial. Remember, for you, the trunk is made up of four parts, which include the chest, the thorax, the abdomen, the pelvis, and the back. All right, including the head and neck. All right, whereby for the appendicular includes the upper limb, the lower limb, the pelvic girdle, and also the pectoral girdle. Are you there? So for the brachial region is literally the answer, because brachial region is literally the arm on the upper limb. Yes, I've talked about that. The arm is also called the brachial region. Do you understand? All these things are easy. They are not hard already. Brachial region came from the Latin word brachium. All right. Oh, I said the answer already. Oh my God. All right, no problem. So let us move into the other aspects. So with all these, we've been able to trash the regions of the human body. All right. In more lessons, we are going to talk about them in depth. All right. All these are just surfaces. All right. So let us proceed to talk about something very essential in the course of this class lesson. Okay, guys, let's get into the next question that anatomy has helped us to answer, and the question is, where is each part of the body located? So the next question is now telling us, okay, where is each part of these body structures located? Pay attention. Now, to answer this question, we have to understand that anatomy describes, listen, the precise, when I say precise, I simply means exact, accurate location of body structures in relationship to one another. I just said something very essential. To answer this question, we have to understand that anatomy describes the precise location of different body structures as seen when I talked about the regions of the body, and also the relationship of one body structure to another. Please listen. To be able to understand where exactly the location of different body structures are and how they are related to one another, you must be familiar with some terms. Listen and listen well. These terms include number one. The first term is called anatomical position. This is very essential. As we go in this class lesson, I'm going to explain to you what the term anatomical position is in anatomy. Because for you to be able to know the exact location, to describe properly the precise and the exact, I cannot just say something randomly. Don't worry, I'll give you an example. Just listen. For you to be able to describe the precise location of a particular structure in respect to another structure in a human body, you have to know some terms. You have to be familiar with some terms. And the first of them is called what? Anatomical position. Pay attention. The next term to be familiar with is what is called anatomical planes. So if we are done explaining the anatomical positions we have, then we move further to talk about the anatomical planes of the human body. These things are essential, very, very essential. And then we move further to talk about what is called directional terms. All these things are so important, and I'm going to break them step by step, and we'll be able to use all of this knowledge to be able to understand the human body. All right, to be able to understand the human body structure and how they are organized to one another, and how they are organized with one another, because this is what anatomy is all about. All right, so let's quickly get into talking about the anatomical position. Now, moving further, before I start explaining to you what anatomical position is all about, now let's take this example. Imagine a healthcare professional is asking three different patients the same question, and the question is this: where are you feeling the pain? Listen, I just said something very important. A healthcare professional asked three different patients a particular question, and the question is, where are you feeling the pain in relation to your stomach? Because you are saying that you are feeling the pain in your stomach. So where exactly? That is what anatomy answers. Anatomy basically helps us to understand location properly. You can say the question, where is each part of the body located? All right. So now we are dealing with pain, and the healthcare professional asks three different patients, where are you feeling the pain? So these are the response of these patients. So this is the first patient. Just listen. The first patient. And if you listen properly to what I just said, I said, where are you feeling the pain in relation to your stomach? Because the patients are complaining of pain in their stomach region, and you know the stomach is found in the abdominal region of the human body. So literally they are feeling pain in the abdomen generally. All right, so listen and listen well. That is why it is essential for you to know the body regions as explained, in the introductory aspect to this class lesson. So the healthcare professional asks, where are you feeling the pain in relation to your stomach? So this was the first patient response. Let me quickly just write three patients. So this is the second patient. All right, and this is the last and the third, which is the third patient. So here are their response. Pay attention. This thing is very essential for us to be able to understand what anatomical position is all about. Now, the first patient says, I am feeling the pain above my stomach. You can see the statement The second, now moving over to the second patient response. The second patient said that I am feeling the pain beside my stomach. Hold on, beside my, so here it says above my stomach. Here it says beside my stomach. All right, just pay attention. All right. And for the third patient, he said, I am feeling the pain below my stomach. You can see all the statements made by these three patients. But if you have an in-depth knowledge of anatomical positions, you'll be able to still tell where the problem is. But these statements are not precise. These statements are not accurate. Do you understand? For a healthcare professional. All right. So in simple terms, just pay attention. So listen and listen well. So the first patient response, I am feeling the pain above my stomach. Well, you know, though we are not talking about the abdomen. All right. So I'm not going to like tell you the specific location to which the stomach is located. Just pay attention. So from the first patient response, he said that he's feeling the pain above his stomach. So maybe he can be feeling the pain in this region. Do you understand what I'm saying? Just pay attention. Beside my stomach, maybe at the side, and below my stomach, maybe close to the pelvic region or stuff like that. So you can see the problem. You can say that all of this could lead to confusion. That is why healthcare professionals now use a standard position as a reference point to describe accurately the position of body parts. And this standard position is what we call anatomical position. Hope you are paying attention. Relax, relax, and relax. So the question we ask ourselves, what do we mean by the term anatomical position? Now listen. Anatomical position is a standard reference position adopted by healthcare professionals, be it anatomists, doctors, nurses, and so on and so forth. All right, adopted by healthcare professionals for describing the location and relationship of structures within the body. Listen and listen well. So this is what we call what anatomical position. It is a what standard reference position adopted by what now healthcare professionals, be it anatomists, be it doctors, nurses, physiotherapists, and so on and so forth. All right, and they use this position as their own standard reference position for describing, the location and also the relationship of structures within the body. All right, we have various structures in the human body. So we use this position to describe these structures within themselves, to describe the relationship between these structures. All right, so that is what we mean by what anatomical position. Just pay attention. Now I've been saying anatomical position. What do we mean by this position? Now listen. In this position, the body stands erect in an upright posture like this. All right, you stand erect in an upright posture. Look at what I'm doing right now. You can see I'm standing erect in an upright posture. Do you understand? So you cannot see my hands. All right, but that's why I drew the diagram on the board. Just pay attention. So this diagram drawn on the board has explained what we call anatomical position. And in this position, there are key things to note. The first thing I just said, the body stands erect in an upright posture. You can see that is the first thing you note in an anatomical position. You can see two, view. This is the anterior view, which is the front view of the person, and this is the posterior view, which is the back view of the individual. We are coming. The term anterior posterior, we are going to see it in more concept in the course of those anatomic basic classes. All right, just pay attention. So this is what we call anatomical position. And the first thing to note in an anatomical position, the body will stand erect in an upright posture, and that is what we are seeing there. You can see it now. The body is standing erect in an upright posture. Note that is essential. You cannot go and stand like this and you say it's an anatomical position. You cannot go and stand like this and you are facing this side, you say it's anatomical position. No, you can also hold your hand and say this is anatomical position. Note all these things, they will help us, all right, to understand location and also relationship, all right, between structures of the human body is essential to note all of these things. So let us move further to learn more things about the anatomical position. As you are seeing the diagram, you'll be able to say a lot of things about anatomical position, but I have to teach you because this is the first time of you learning this concept. They are all very easy, they are not difficult at all. If you found my video lesson helpful, ensure you do well to subscribe to my YouTube channel and also share my lessons with your friends. Another key thing about anatomical position is that the head is held straight like this. Do you understand? It's held straight. You can see it's facing forward, not like this, not like this. The head is what held straight. Note it is essential. That's the second point about anatomical position. Even in the back view, the posterior view, you can see it's still held straight. Note it is essential. Questions will come from this aspect, so you have to note it. These are the basic things you have to know. So you cannot study different structures. I told you that anatomy is studied region by region. Your professor will just tell you guys in this semester we are going to study the head and the neck region. So that's how they study anatomy. You cannot just study it in one semester because it's very broad, but they are all easy. Understanding these bases will save you a lot as you go deeper into the field of anatomy, and they are not hard at all. All right, so that is for that. So let us move further to more concept about the anatomical position. Moving further, in an anatomical position, the eyes and the face are directed forward. Like I said initially, the head is held straight and the eyes and the face are also directed forward. So I've said three things. Note all these things that will help you a lot. Note them, they will help you a lot, all right, in answering multiple choice questions. So we said that about that, the third point. Let's move further. Now, moving further, you can even tell me from what you are seeing, you can actually describe, because we already know that these are the upper limbs. Now, look at what happens in an anatomical position. The upper limbs hangs naturally by the side of the body. You can see now they are hanging naturally by the side. That's how you don't do like this. You can say this is not anatomical position. This is not anatomical position. This is not anatomical position. All right, the upper limbs will hang naturally like this. All right, by the side of the body, not here. Do you understand? That's what I mean by what anatomical position. Very essential. Let's move further. Now, another key point you have to note about the anatomical position. You can see that the upper limbs are hanging naturally by the side of the body. Now, what can you observe about the hand? About the hand, because this is the hand, right? We said that already. The hand, are they facing? That's the palm. This is the palm of the hand. This is the palm of the hand. Are you there? So the palm of the hand, are they facing forward or backward? Actually, this is the typical view of an anatomical position. This is just back view. We use this as our reference point. So the palm should be facing forward, not backward. Forward in an anatomical position. Forward like this. And another key point is that the fingers, note all these. As I'm saying it, note them. The fingers are extended. You can see extended. You can see what I'm saying. The fingers are extended and they point downward. All right, you don't extend them like this. They point what they extend and they point what downward. That's what we're saying here. All these things are essential. Note them. And most importantly, the thumb. These are the thumb. Your thumb now. The thumb are pointing away from the body. They are positioned away from the body. The way this individual is standing, you can see that the thumb, these are the thumbs. All right, they are pointing away like this. These are anatomical position. Thumb will not be like this. This is not anatomical position. They must be pointing away from the body. Moving further, for the lower limbs, they are placed together or slightly apart. You can see now. They are placed together or slightly apart. Are you there? Not all these things are essential. And the feet of the legs are flat on the ground and directed forward, not like this. They are directed forward. You can see what is happening. So all these said are what we call the anatomical position. which is the reference point, the reference position healthcare professionals use, all right, pay attention, use to describe the location, not just the location, the relationship within structures of the human body. Because we are going to see a lot of examples and play with a lot of examples, practice. So when you are studying, things will be easy for you to understand. Because you cannot cram everything. You have to take it step by step. And this is what you need to understand, future things to learn in anatomy. All right. So that is for that. Let us move further. And note something very essential. Don't confuse an anatomical position from the position of a person standing. No, a person can be standing anyhow. Do you understand? We are standing now. Do you understand? That's not anatomical position. Do you understand? A very key note about anatomical position is that the hands are, they are hands naturally by the side of the body, and the palm is not facing the thigh. This is the thigh. Do you understand? It must be facing, forward, not facing the thigh. Not all these things, they're essential. So let us move further. So with all of this said, let us quickly solve some practice questions on anatomical position. All right, all these questions are multiple choice questions that are very essential for your exam. All right, if you are offering anatomy in your program, be it in nursing, medicine, physiotherapy, medical laboratory science, and so on and so forth, and also radiography as well. All right, so let us get into these questions. So here is your first practice question based on what I've explained. It's so easy, you can solve it. All right, so that is for that. It says anatomical position is best described as, so you know what to do. Option A, you can see there. Option B, so choose the right option and provide the answer in the comment section. State on anatomical position question 1, put your answer there in the comment section. Let's get into more smarter questions on the anatomical position. Okay guys, this is the second practice question on anatomical position. So do what to provide the answer in the comment section. It is very easy. The question says, which of the following is a characteristic of the anatomical position? Is it the palm facing backward? Don't do that. Is it the body lying flat? Stand upright. Is it the palm facing forward? I don't know. And option D says the eyes are closed. So provide the answer in the comment section. Let's get into more practice question on anatomical position. Okay guys, this is your next practice question. It's very easy, and it says, which of the following is not a feature or a characteristic of the anatomical position? Read through all of the options and provide the answer in the comment section. It is very easy. Let's get into more practice question on this aspect. You can see that they are all very easy, because learning all of this will help you greatly when you start learning all of the regions, like the head region, the neck, like that. We are coming, because I told you that for we to be able to understand where exactly the body parts are located, we need to understand the following, which include number 1, anatomical position. The next we talk about was the anatomical planes, and lastly, directional terms. So you can see that we are still on anatomical positions. We are coming. All right. After this, we get into talking about the anatomical planes and discussing things that are essential. Then, like that, we'll know that we are grounded on this aspect of anatomy when it comes to the introductory aspects. Then we move into learning each part of the regions of the body step by step in details. So get ready. So if you have not yet subscribed to my YouTube channel, ensure you click on the subscribe button and also share this lesson with your friends. Okay guys, here is another practice question on anatomical position. After this question, we then move further to other aspects in the course of this class lesson. And the question says, a student stands upright, all right, upright with the arm by the side. So the arms are by the side. Remember, arm is also called what now? The brachium. Or what now? The brachial region. Brachium is the Latin word for what now? Arm. We said that when we started this class lesson. And the face directed forward, the way it is in this diagram, However, the palms are facing the thigh. The palms now are facing the thigh like this, are facing the thigh, but it should not be facing the thigh. It should be facing what? Forward, anteriorly. It should be facing what? Forward, not facing the thighs. You understand? Which features prevent this from being the anatomical position? Is it the student standing upright? Is it the arm by the side? Is it the face facing forward, or the palm are facing the thighs? So provide the answer to this question is very easy. So let's get into more aspects on this aspect of anatomy, which is the introductory aspects to anatomy. All right, so get ready. Okay guys, let's get into what we call anatomical planes. Pay attention. Anatomical planes are imaginary flat surfaces, or we can just say they are imaginary lines that passes through the body in the anatomical position. I am coming, hold on. All right, I'm going to explain to you practically what anatomical planes is all about, so just pay attention. Now we said that these anatomical planes are imaginary flat surfaces or lines that passes through the body in the anatomical position and divides it. Listen, after passing through the body, it divides it into different sections for the purpose of one, studying the internal structures of the body and also describing the structure of the body. Just hold on. I just said something very essential. So you have to note what I just said is very important. Now, the question we ask ourselves, why is the study of anatomical planes very important? Because it is so vital. So that is why you have to understand what anatomical planes is all about. And I'm going to explain why, the study of anatomical planes is very essential. The human body is three-dimensional and it consists of numerous organs, numerous muscles, blood vessels, nerves, bones, and so on and so forth. Numerous. And anatomical planes are imaginary lines or flat surfaces that divide the body into different sections. And this makes the study of this internal structure so easy, because you cannot just take a human being and start studying the person if you cannot divide that individual into sections by using your imagination. That is why we said that they are imaginary lines or flat surfaces. Just hold on, I'm going to explain something very essential. So you can see why anatomical planes are so essential. It divides the body into different sections, so as for anatomists to be able to study different part of the body and understanding how they relate with each other. Now moving further, let's get into discussing about the anatomical planes. And the first of them I'll be talking about is what we call the median. All right, the median plane. And if we don't call it the median plane, we can call it the mid-sagittal plane. Pay attention, all right? If we don't call it the median plane, we can call it what? The mid-sagittal plane. This is so essential. Then I have to explain to you what the median plane is all about. Now moving further, you can see from the word median, it has to do with the middle, all right? So pay attention. The median plane is a vertical plane. I do not say it's an horizontal. All right, it is what? A vertical plane that passes the exact center of the body. So let's assume this is the center of the body. Pay attention. All right, this is the center of the body. You can see how I'm drawing it. Just pay attention. I'm taking a line or a plane down. You can see what is happening. So this thing drawn now is what we call the median plane. All right, also called the mid-sagittal plane. It is what? A vertical plane that passes through the exact center of the body, dividing the body into two equal right and left halves. Listen, this, when you stand anatomically, this is your left, while this is your right. Hope you are aware now. This is my right and this is my left anatomically. You looking at me now, this is my right while this is my left. Well, if you are looking at me, but we always stand anatomically. This is my right and this is my left, all right? So this median plane or mid-sagittal plane, it is a vertical plane that passes through the exact center of the body, all right, dividing the body into two equal right and left halves. Hope you are aware. All these things are easy, they are not hard at all right? You can see what we just explained about what? The median plane, also called the mid-sagittal plane. Now, what are the clinical significance of this plane called the median plane? Is that it helps healthcare professionals to be able to describe properly structures that are close to the midline, like the nose. Are you not seeing what I'm saying? Like the mouth. All right. It helps healthcare professionals to be able to, we said that the importance of these anatomical planes is that it helps healthcare professionals to be able to study in depth the internal structures of the body in sections. All right. So it can help an healthcare professional to be able to understand, study properly the right half of the body and also the left half of the body, seeing all the structures, the internal components. Because when you cut a particular object, from the center, you'll be able to see what is inside one half and the other. You understand what we are saying? That is what the median plane talks about. And also the median plane, helps healthcare professional in identifying abnormalities that can affect one half of the body. Like for instance, let's say stroke affects one side of the brain. You can see what we're talking about. That's why median plane is essential. It helps, a healthcare professional to be able to identify abnormalities that can affect one part of the body, like brain tumor in one hemisphere. Do you understand? That is what this median plane talks about, and that's the clinical significance of this plane. Let's get into the next plane that must be noted on the anatomical planes. So let's get into the next plane, and the next plane to talk about is what we call the sagittal plane. All right, just the sagittal plane. Pay attention. Now, when a plane is sagittal, it is also a vertical plane. All right, sagittal planes are planes that runs, parallel to the median plane. Wow, look at it. They are also vertical planes, the way this plane is. All right, but what they do is that they run parallel, in the sense that parallel lines are lines that don't meet. All right. So in summary about this sagittal plane, the half they are going to produce after you have actually used the imaginary line to cut through that body part is basically on equal halves. Like for the median plane, we had equal halves, right and left halves, right? But for the sagittal plane, we are going to get what? On equal halves. This is essential, you must note it. Example of the sagittal planes. Pay attention, pay attention. Example of a sagittal plane could include a plane passing through the right eyes. Remember I said, if we want to identify the sides of our body, we start anatomically. This is my right eye. So a plane passing through, let's say this is right eye now. So a plane passing through this right eyes only. What is this plane called? You can see the right eyes. What is this plane called? A sagittal plane. Because it is running parallel to the median plane. And also it's not touching, it's vertical as well. And it's not touching the median plane. That's why we say they run parallel. Parallel lines are lines that don't meet. Alright. So for instance, a plane, passing through the left ears. This is the left ear. So this is the left ear. A plane cutting or passing through the left ear. What we call this plane now? We call it what now? A sagittal plane. This must be noted because questions on this aspect can come in your exam. You have to understand these things very well. They are not hard at all. Now moving into the next plane, which is called the coronal plane. All right, the coronal plane. The coronal plane is also called the frontal plane. This is a plane that divides the body into the anterior portion and the posterior portion. Anterior means front portion, and what are the posterior portion? Like for instance now, they cut an individual from the head, not like it's a vertical plane as well. All right, it's vertical, but not like the way we are seeing it here. When we cut the individual, like the way that, let's say this is one individual, they now cut this individual to form the back. This is the posterior part, and this is the anterior part. Let's say this person was cut into two from the head. Do you understand? So we call this what, a coronal plane, or what now? A frontal plane. Are you there? Coronal plane, or what now? A frontal plane. They can ask you a plane that separates the face from the back of the head. What is that plane called? Coronal plane. The face from the back of the head. What's that plane called? Coronal plane. All these things must be noted. They are not hard at all. Like for instance, a plane that cuts through the shoulder, showing the anterior shoulder and the posterior shoulder. This is back. Posterior shoulder. You can see I'm using these two words. I've been using it. Anterior, posterior. So you should be aware that whenever you hear anterior, it simply means front view. Whenever you hear posterior, back view. So what plane cuts the shoulder to show the anterior and the posterior view? What's that plane called? Coronal plane. Also called what? The frontal plane. All these things must be noted. Let us move further. Moving further, let's get into the next plane called the horizontal plane. For this plane, you can see the word horizontal. Listen, from the median plane, sagittal plane, coronal plane, they are all vertical planes. This one is now horizontal. This is a plane that cuts the body into two portions. All right, two portions. Listen, normally corona also cuts into two portions, but we have the anterior and the posterior portion. But for the horizontal, it cuts from the center of the body. Like this is what I mean. Using this individual to explain horizontal plane, the line will come from here. Listen, it's going to come from, maybe the plane will come from the waist region. All right. So this plane you are seeing, this imaginary line that cuts this person, this individual, so dividing this person into two portions, which is the up or the above portion and the below portion, but it's not called above or below, but rather it's called the superior portion and the what now? Inferior portion. So they can ask you the plane that divides or cuts, into the superior and inferior portion. What will you call that plane? Horizontal plane. Horizontal plane is also related to be called transverse plane or axial plane. All these things are essential. You have to note them. If you don't call it horizontal or transverse, you can call it the axial plane. And it's a plane that cuts or that pass through a surface, dividing it into what now? The superior view from what now? The inferior view. Listen and listen well. These things are essential. They will help us in the other aspect to be discussed called directional terms. All these things you're going to see in directional terms, and that is very essential. Another plane that is also important is what we call the oblique plane. Pay attention. This one is called oblique plane. This is a plane that is neither horizontal nor vertical. It is just a plane that passes through a major anatomical plane at an angle, forming an angle. Listen. So the oblique planes, they pass diagonally. Diagonal lines are slanting lines, all right, that can actually, form any angle other than 90 degree. They can form any angle but not 90 degree. So basically, an oblique plane can come from here. Let's just pay attention now. Just pay attention. Remember, what plane was this? What plane divided the body into the superior portion and the inferior portion? The horizontal, also the transverse or axial plane. So if this plane now comes like this, you can see where it's coming from. It's dividing the body in this direction, forming an angle here. All right, I know there are writings here, but there is an angle here. Like for instance, this one, this horizontal plane now. All right, so oblique is not coming like this. Do you understand? Which is the diagonal plane. So a plane that runs like this is an oblique plane. All right, forming an angle but not 90 degrees. All these things are essential to be noted for your exams. Now, it must be noted here that the sagittal plane can sometimes be called the parasagittal plane. Just note it. If you don't just call it sagittal, you can just call it the parasagittal what plane. But for the median plane, it's also called the mid-sagittal plane. All right. So with all this said, we are done on anatomical planes. So let's get into answering some possible multiple choice questions on this aspect before we get into the other aspect in the course of this introductory class lesson, which is called directional terms. Okay, guys, let's answer these questions together on anatomical planes. They are all easy, and it says the first one says a plane passing through the nose, the sternum, which is the breastbone, and the umbilicus, which is this region. All right, this is the umbilicus. A plane passing through, listen, the nose, the sternum, and the umbilicus, and divides the body into two equal halves. What's that plane called? Tell me. Is it the median or the mid-sagittal plane, or the sagittal plane, or parasagittal plane, or the coronal plane, or the oblique plane, or the transverse, horizontal, or axial plane? What is the answer? Provide the answer in the comment section. I've taught you already. You can do it. Now, next question says, a radiologist obtained an image that separates the chest from the back. Which plane was used? So easy. I told you to separate, anterior from posterior view, because chest is the front view, back is the posterior view. So which plane separates the anterior view from the posterior view? Because that's what this question talks about. Provide the answer in the comment section. I've taught you already. It's so very easy. Let's get into more smarter questions before we get into directional terms. Okay, guys, here's your own practice question. Ensure you provide the answer in the comment section. So easy. Which of the following structures would be separated by a transverse plane? First of all, you have to know the other name of transverse, which is also called what? Horizontal or axial plane. All right. Now, passing through the neck is passing through the neck. This plane, this imaginary line. So the answer, which structures will be separated? When a plane passes through the neck, which structure will be separated? I think it is the head and the chest region. All right. Provide the answer in the comment section. It is very easy. It's not difficult at all. All right. So that is for that. Let's get into the next aspect on this introductory class lesson on anatomy called directional terms. Okay, guys, let's get into what directional terms is all about. Now, directional terms are standard anatomical terms used to describe the direction of one part of the body, all right, in relation to another part of the body. Pay attention. Directional terms are standard anatomical terms used to describe the position of a particular structure in the body in relation to another structure in the body of that individual. Pay attention. This is what we call directional terms in anatomy. All right. So let's get into the first directional term. I'm going to use this term to make a lot of examples. So pay attention. The first term I'll be talking about is what we call medial. Please pay attention. This is the first term I'll be talking about, and it's called medial. Now, listen properly. You can see this is the first directional term I'll be talking about. Looking at the word medial, it is sounding like median. Pay attention. Look at the way I want to start it, all right? Medial is the first directional term. A structure in the body of an individual is said to be medial if it is close to the midline. This is the midline called the median plane, also called what now? The mid-sagittal plane. So this is the medial plane. I want to clean this plane, all these planes drawn here, all right? So a structure is said to be medial if it is what? Close to the midline. And this is the midline of this individual, all right, which is the center, the middle, right? And we said that for you to tell the exact location of a particular structure, you have to, relate it to the position of another structure. Yes, we said that, very essential. So let us observe the nose and the eyes together. Which structure is medial? between, listen, so easy, between the nose of this individual and the eyes, which is medial. I told you, for you to be media, for a structure to be media, is closer to the mid line, the mid plane, the what now? Mid sagittal plane. So basically, looking at this, which one is medial? It is the nose. The nose is medial. Now we are relating the nose and the eyes. So how do we say it now? We simply say that the nose of this individual is what? Medial to the what? Eye. But to be specific, we have to tell the position of the eye, or the which half of the eye. We start anatomical. This is the left eye. We are using the left eye in this case. So we simply say that the nose is medial to what now? The left eyes. Do you understand what is happening about directional term? It tells us like it is the right anatomical term that describes the position of a particular structure in relation to another. Do you understand? So you must see two structure when you are talking about what now? Directional terms. We'll learn as much we can learn in this aspect on introduction to anatomy. All right. So if you find my video lesson helpful, make sure you click on the subscribe button to my channel and also share my lessons with your friends. Okay, guys, moving further, we are still on this directional term called medial, and you can see that from the word medial, it has to do with median, which we have explained already on the types of anatomical planes. And I believe you know that this is the median plane, which we have explained already. You know, from previous explanation, I have said that to understand the usage of these directional terms in anatomy, there must be a relationship between two structures. You can see from the first example on the directional term medial, you can see we used two different structures to explain what medial is. And as we go in this class lesson, I'm going to give us a lot of examples to understand the usage of these terms, because these things are very essential. So you can see we said that the nose, which is one structure, is medial to the eyes. And from the word medial, it means median, which is at the center or close to the center. Just pay attention. Just listen, because I want to give us some more examples to understand medial as a directional term. So let's relate also two structures. Let's relate together the mouth of this individual. Remember, to understand directional term, to use directional term properly, that individual must be standing in an anatomical position. If that person is not standing in an anatomical position, whatever you are describing, whatever structure you want to describe, the location might be wrong. So pay attention. This individual is standing in an anatomical position. Then let's describe now the relationship between the mouth and the cheek of this individual. How are we going to describe it? What do we say using the directional term medial? Now listen, can we say the cheek is medial to the mouth? That is wrong. Because from the word medial, it simply means that that structure is closer to the midline. You understand all what we have said now? It means that that structure is closer to the midline than the other. So the mouth and the cheek, which is closer to the midline or which is at the midline, that's what you pay attention to when you want to use the medial as a directional term. The mouth is closer to the center of the individual, is closer to the midline of this individual. Then saying that the cheek is medial to the mouth is wrong. Do you understand? Hence, the mouth of this individual is medial to the cheek, because it's closer to the midline than the cheek. Because we said that to use directional term, there must be a relationship between two structures. You can see how easy it is. It's not hard at all. I'm going to give us more examples and more practice questions to understand medial as a directional term, to understand anatomy introduction, because as we go deeper in this class lessons, we're going to talk about the internal structures to understand the usage of these terms. which are directional terms in anatomy. So get ready. Now, another thing that must be noted in the usage of directional term, we most times use directional terms to relate structures that are in same region. See, this is what I mean. You can see that I am using this directional term medial for structures that are in the cephalic region of this individual. I believe you know what cephalic means now. It means the head region of an individual. So we have talked about the regions of the body, all right? Now, listen and pay attention. For instance, I want to relate the nose of this individual and the thumb of this individual, and I want to use medial as the directional term to relate both of them. How will I say it? How will the statement look like? I will simply say that I'm asking you, put it in the comment section, between the nose and the thumb of this individual, which is medial to each other, it is the nose, because the nose is closer to the midline. Are you there? So basically, when we talk about this directional term, you take note of the term and see what it's talking about before you can start using it. You cannot just use it anyhow. You understand what I'm saying? So all this must be noted. So we can simply say that the nose of this individual is medial to the thumb. But looking at it anatomically, it is correct, but the comparison between these two structures, the nose and the thumb, is less useful. Do you understand? Though it's correct. Do you understand? But most times we relate structures that are in same region. Now, let's say for instance, pay attention, we are still on medial term. Let's say for instance, we want to compare two structures in the hand region of the body. So I'm comparing this structure and this structure. Hope you are aware that this is the little finger, or everyday English you call it pinky finger, or the fifth digit. That's this one. Are you there? And what about this? This is your first digit, or you call it anatomically, it's called ponics. Pay attention. Or you can call it your thumb. So you can see now, let us relate both structure in relation to the term medial. Which one is medial to the other? It's very easy. Remember, for you to get the answer or get the correct statement, check between both structure. Which one is closer to the midline? Because I'm using medial because we want to use medial to relate both of them. So we have to know which one is medial to each other. Do you understand? You want to know which one is more medial to the other. Just pay attention. It's not difficult at all. That's why I said you must ensure whenever you are describing using directional term, that individual must be standing in an anatomical position. You can see this person is standing in an anatomical position. Hence, which one is more medial? Which one is closer to the midline? Which one is closer to the median plane? Which one is closer to the center of this individual? It is the pinky, or the little finger, or the fifth finger. Hence, we simply say that the little finger is medial to the thumb of this individual. Hope is making sense. All these things are not hard. I'm just using the external structures, the one you can easily relate to. As we go deeper into all of this class lesson, we are going to pick organs to understand them properly. Different structures of the body. If you find my video lesson helpful, make sure you click on the subscribe button to my YouTube channel and also share these lessons with your friends. Now, let us play with other regions of the body. Let's talk about this, the chest region. There is a bone that is in this position of an individual called the sternum. I hope you are following me. This is not a skeletal diagram. This is diagram of a human being. So there is a bone here, which is usually called the breast bone. So and then there's also another bone that is also intended to be called the beauty bone, also called the clavicle. Hope you are aware. So the clavicle is situated here of an individual. This is your clavicle, and this is your breast bone. So relating the breast bone or the sternum with the beauty bone or the clavicle, which one is medial to each other? It is the sternum that is medial to the clavicle, not the clavicle medial to the sternum. Hope all these things are making sense, because I want you to understand them properly. That's why I'm taking my time to explain all of these things. They are very essential. Now, going over to another region like the abdominal region, the abdomen, this is your umbilicus. Now, relating the umbilicus and the hip, which is more medial, the umbilicus is medial to the hip. Hope it's making sense. Now, you can see all these things are not hard at all. Let's get into the usage of another directional term in anatomy, and that term is called lateral. So let's play with lateral as a directional term in anatomy. Okay guys, moving further, let's talk about lateral as another directional term. Now pay attention. A structure of the body is said to be lateral if it is farther away from the median plane in relation to another structure. It's not hard, I repeat. A structure in the body is said to be lateral to another structure if it is farther away from the median plane. Wow, so what I just said is like the opposite of what I said, because for a structure to be medial, it is closer or at the midpoint of the body in relation to another structure. But now for a structure to be lateral to another structure, it must be farther away from the median plane. Relax. I want to relate two structure of the body using the directional term lateral, and you see how it works. It is not hard. So let's relate again. This time around, the nose and the eyes, that was what I wrote on the board. Let's play with this. It's not hard. Using the word lateral. So so I'm asking you now, is it the nose that is lateral to the, now? Is it the nose that is lateral to the eyes? No. Because for it to be lateral, you will be farther away from the median plane. So what becomes the right statement? The eyes is lateral to the nose. Yes, now. Yes. We said the nose is median to the eyes. Very correct. So in this case now, the eyes, all right, if you are using any of the eyes, the left eye or right eye, is lateral, pay attention, to the nose. Very correct. Because the eye is farther away from the mid-plane in comparison with the what? Nose. Which one is closer to the mid-plane? It is the what now? Nose. Which one is farther away? Is the what? Eyes. That's why the eyes is lateral. It's not hard. It's very easy. Now let's compare the ears and the eyes. Which one is more lateral? The ear right now is lateral to the eyes. Let's compare the ear and the mouth or the nose. The ear is lateral because towards the side is farther away from the mid-plane. These are the things you should understand. It's farther away from what? The median plane for lateral. They are not hard at all. They are all very easy. Using more examples, the cheek is lateral to the mouth. It's not hard. All these things are easy. They are not hard at all. You can see how it works. Whenever you are lateral, you are farther away from the mid-plane. So that structure must be farther away from the mid-plane in comparison with another structure. That's how it works. So in this case, the clavicle now is lateral to the sternum or the breastbone. It's not hard. You can see how easy all these things is. Now comparing the thumb now and the little finger, also called the pollex. All right, this one now, the thumb, also called the pollex in anatomy, is lateral to the little finger. That's how all these things works. They are not hard at all. Okay, guys, let's get into another directional term. In this case, the directional term we'll be talking about is what we call anterior. Please pay attention. What does this mean? Now pay attention. A structure in the body is said to be anterior if it is closer to the front of the body. This is your front and this is your back. So for you to be anterior, the structure must be closer to the front of the body. That's how it works. Now let's relate. Let's relate the eyes and the ears. Now, which one is anterior to the other? It is the eyes that is anterior to the ears. You cannot tell me that the ears are anterior because which one is closer to the front of the body? It is your eyes now. That's how it works. It is not hard at all. And another term for anterior is ventral. Please take note. So I can simply also say that the eyes is ventral to the ears. I'm correct in anatomy. Please note all these things, they are very essential. Now let's play with more examples. Relating the eyes and the back of the head. You know, the back of the head, they call it occiput in anatomy. So relating the eyes, which one is anterior? Because for you to be anterior, you're closer to the front. So the eyes anterior to the what now? Occiput, which is the back of the head. You can see how all of these terms work. It's important to understand these bases. When you start learning, you know, organs, different organs of the body, when you see your textbook, they're writing things, you know, because most times students tend to cram all these things and not understand them. You cannot cram everything. They are too much. But that doesn't mean that you cannot understand them. That's why these bases are essential. Remember, we are using the external structure of the body. We'll get inside the body structure and see a lot of things. So you just relax and get ready. You can see all what we have done. They are all very easy. You can see my comparison is based on region by region. Alright, it's best you compare that way. Alright, if I will compare, you know, in the thorax region, I will compare and I'm okay. Do you understand? Now, comparing the umbilicus and the gluteal region of the body, this gluteal region, which is anterior, so easy. It is the umbilicus that is anterior to what now the gluteal region, the buttocks of the body. You can see how all this works. They are not hard at all. Let's get into another directional term in anatomy. And the term is number 4, called posterior. Now, listen. A structure of the body is said to be posterior if it is closer to the back. So that's why posterior is back. This posterior view, this anterior view or ventral view. Do you understand? So a structure is said to be posterior if it's closer to the back of the body than another structure. So relating the occiput now and the eyes, which one is posterior to each other? The occiput is posterior to the eyes. The ears is posterior to the nose. You understand what is happening? They are not hard at all. All these things are basic and they are not difficult at all. Let's get into more directional terms. And another name for posterior is dorsal. Dorsal. So they don't say this structure is posterior to another structure. Say that that structure is dorsal to another structure. Note all these things. They are essential. Now, moving over to another directional term called superior. Pay attention, all right? Now, a structure of the body is said to be superior to another structure if it is closer to the head region. That's what we mean by superior. So, relating the head now and the neck, which is more superior to each other, it is the head. We simply say anatomically that the head is superior to the neck of the body. And if you don't call it superior, you can call it cranial. So the head is cranial to what now? The neck. Are you there? All these things are very easy. They are not difficult at all. Another example is that the nose is superior to what now? The lips. You can see how all this works. They are not hard at all. Whenever you are superior to another, you'll be closer to the head region. That's what superior is. And if you call it superior, you call it cranial. Now, moving further, what about the ears? The ears are superior to what now? The shoulders. You can see what we are talking about. That's what superior is. It's not hard at all. Now, moving further, what about the thorax and the abdomen, which is more superior to each other? Please provide the answer in the comment section. Make a correct statement relating the thorax and the abdomen using the directional term superior. Let's see what you can do in the comment section. All these things are very easy. They are not hard at all. Now, moving over to another directional term, and this time around, it is called inferior. If we don't call it inferior, we call it caudal. Now pay attention. A structure is said to be inferior when that structure is farther away from the head region. It's very far away from the head region or below the head region. That is what we mean by a structure being inferior. And if you are not inferior, you are caudal. So making an example with the term inferior, we simply say that the patellar region, which is the front part of the knee, is inferior to the hip. We are correct, because you are far away from the head, or even closer to your feet region. Do you understand? That's what inferior means. And the term inferior is also called caudal. Not always essential. Now let's get into another directional term that is very essential, and this term is called proximal. Now pay attention. A structure is said to be proximal to another structure if that structure is closer to a point of attachment. Or we simply say nearer to a point of attachment. Now listen properly. In humans, the word proximal is used for the limbs mainly, which are the upper limbs and the lower limbs. Are you there? Now pay attention. Now just listen. Where is the point of attachment of the upper limb? This is the point of attachment. This is the point he attached to the body, which is, it's attached at the trunk region of the body. So now relate. Now pay attention. On the relate, I said that the word proximal is used for limbs. This is the shoulder region, and this is the elbow region. Now we said that our reference point is that if you are closer to the point of attachment, that's when you are proximal to another structure. So relating the shoulders and the elbow, which is more proximal in respect to where it's coming from, to where it's attached from. It is the shoulder that is proximal to the what now? To the elbow. Based on what? The point of attachment, which we have talked about. That's what it means. It's not hard. So for you to know a structure that is proximal, you try to relate the point of attachment, which one is nearer to the point of attachment. That is structure that is more proximal. So relating now the elbow and the wrist, which is more proximal, it is the elbow, because the elbow is closer to the point of attachment. Now I'm making more examples. The arm. Now between the arm and the forearm, this is the brachium and the antebrachium. Which is more proximal? It is the arm, because the arm is closer to the point of attachment. And point of attachment of the limb is what? The trunk of the body, which I told you already. And I believe you know what I mean by the trunk, the component of the trunk of the human body. All these things are essential, they are easy. So you can see how it works, what proximal actually means. Remember I said that we'll go deeper into internal structures to understand all of these terms properly, to be able to get the full picture of this term in anatomy. Now another directional term to learn is what we call, that's number 8, is what we call distal. Pay attention. A structure is said to be distal if it is farther away from the point of attachment. It's like, if you observe what has been happening, listen, like both of them are opposite to each other. Both terms are opposite. Same applies. Both terms are opposite. Same applies. Both terms are opposite. Now both terms are still opposite. Distal, a structure is said to be distal when it is farther away from that point of attachment, which is its trunk. So relating now the forearm and the arm, which is more distal in relation to the point of attachment, it is the forearm that is farther away from the point of attachment, which is what? The trunk. Hope all these things are making sense. They are not hard at all. Now moving into more directional term, like the term superficial. Now that's number 9. Let's get into number 9, called superficial. Pay attention. A structure in the body is said to be superficial if it is closer to the surface of the body. Very easy. That means the skin is superficial to our muscle. Yes, the skin is superficial to our bone, because before you can see your bone, the skin needs to be removed. Do you understand? That is what superficial actually means. Let's get into another directional term called deep. All right, that's number 10. Deep is another very key directional term that we'll get to see as we study anatomy, in more aspects. Now it's very easy. A structure is said to be deep when it is farther away from the surface of the body. It makes sense. That means the bone is deep in relation to the skin. Do you understand? All these things are not hard. They are all very easy. Let's get into more directional term in anatomy. Okay, guys, moving further, let's get into the next directional term, and this term is called pay attention. Number 11, all right? This term is called ipsi, pay attention, ipsilateral. What does it mean for a structure to be ipsilateral to another structure of the body? Pay attention. A structure is said to be ipsilateral when they are located on the same side of the body. It's very easy. The word ipsi, this word IPSI simply means the same, all right? And lateral, we've built on the basis of lateral, which means towards the side. So now a structure is said to be ipsilateral when they are located on the same side of the body. Now pay attention. Now you can see, we stand anatomical. This is my left and this is my right. So this is the left eye. Are you there? And this is the left ear. They are located at the left side of the body. Hence, the left eye and the left ear are ipsilateral structure, meaning that the left eye is ipsilateral to the left ear. You can see how it works. All these things are very vital to understand anatomy properly. Let's get into more other directional terms before we start answering practice questions on all what we have learned on directional terms. Okay, guys, let's get into the next directional term. And this term is like we discussed about one, we'll talk about the opposite like that. So the next one, which is directional term 12, is simply called, pay attention, contralateral. So what does it mean for a structure of the body to be contralateral? For a structure or for structure, because when we talk about directional terms, we relate two structures. So for structures, you can say I added S. To be contralateral, it simply means the opposite of ipsilateral. So since ipsi is same side, contralateral structures are structures that are located on opposite sides of the body. So a structure is said to be contralateral to another structure if they are located on both sides of the body. And when we talk about directional terms, we basically talk about these majorly on same regions of the body. So basically, looking at the left arm, this left arm is contralateral to the right arm. Are you there? You can see, because this is same region of the body. Looking at the left eyes is contralateral to the right eyes. You understand? Looking at the left ears is contralateral to what now the right ears. You can see how it works, and it is not difficult at all. Let's get into practice detailed smart questions on all what we have said on directional terms. Get ready.
This is the first question, and it says the sternum is dash to the vertebral column. What is the answer? You can see the diagram in this skeletal picture. So do well to provide the correct answer to the question. It is not hard at all. Okay, guys, let's get into the next practice question, and it says, which statement is anatomically correct? Option A says the elbow is proximal to the shoulder. Option B says the wrist is proximal to the elbow. Option C says the shoulder is proximal to the elbow. And option D says the hand is proximal to the shoulder. So provide the correct answer to this question, because it is very easy. When answering questions on this aspect, try to be able to relate with whatever you are reading. Don't just read and try to relate it with your own body. You'll be able to get the answer correctly. As you are reading all of these statements, relate it with your own body. You see that it will make sense more to you, and definitely you'll be able to understand whatever you are studying if you are studying your textbooks. So all these things are easy, they are not hard at all. Okay guys, the next set of questions will come from this diagram shown here. So what you have to do right now is to save this diagram on your phone. You can screenshot the diagram, and the next clip of this lesson will be based on the questions that have been drafted from this diagram, because I want you all to understand properly how all of this works. So when you are studying, when questions are asked, you don't think too far. It's actually very easy if you understand the basic concepts I have explained. And I believe all of the concepts were explained in a very easy to understand format. So do well to answer the 20 questions, because the questions I drafted out from this picture are 20. So do well to answer the 20 questions from this diagram here. So, for you to answer, you look at the diagram, and provide detailed answer to the question. It's not hard at all. Okay guys, this is another diagram you have to study through to be able to answer the next set of questions in the next clip of this class lesson. As you can see right now, this diagram explains the anatomy of the mouth, all right? So you have to look at the diagram properly to answer the questions on directional terms in anatomy, because they are all very easy. Save the diagram and answer all of the questions in the next clip step by step.
Okay, guys, we have come to the end of this class lesson. If you find my video lesson helpful, make sure you click on the subscribe button to my YouTube channel and also share my lessons with your friends. And thanks for watching.